Welcome to the second part of every drug explained and ranked in terms of how dangerous they are. In the previous video, I explained stimulants, depressants, and opioids. And in this video, I'll explain the rest of the drugs. Cannabinoids are a class of compounds that interact with cannabinoid receptors in the body. The drugs in this category cause anxiety, dry mouth, paranoia, excitement, and relaxation. The following drugs fit in this category. Marijuana or weed is a green or brown mixture of dried leaves, stems, seeds, and flowers of the cannabis plant. The active agent that leads to the high is THC. The only bad effects I could find are associated with long-term effects of regularly using the drug, which are impaired memory and concentration. Regarding how dangerous it is, the addiction level pales in comparison with nicotine. It can be addictive, but not as much as nicotine or other drugs. Therefore, I'll give it 2 skulls, which is moderate damage, not totally safe, but it doesn't come close to the drugs from the previous video. Spice refers to synthetic cannabinoids. The composition of spice can vary. This drug is basically like cannabis, but more unpredictable, because spice is usually way more potent than weed. Spice can cause dangerous effects such as severe anxiety and hallucinations. 3 skulls for spice, which is dangerous, mainly because the potency can vary. Psychedelics are a class of substances that alter perception, mood, and cognitive processes, often by affecting serotonin receptors in the brain. The drugs in this category cause hallucinations, panic, euphoria, and loss of coordination. The following drugs fit in this category. Magic mushrooms are naturally occurring and are consumed for their hallucinogenic effects. Magic mushrooms look much like ordinary mushrooms. The key ingredient in magic mushrooms is psilocybin. Use of any drug can have risks. Tolerance usually develops rapidly with continued use, resulting in the drug having little to no effect over time. However, shrooms are not psychologically addictive, nor physically addictive. But having a bad trip can be horrible for the mental state of user, despite of the fact that you cannot overdose from this drug, nor it causes health problems. Therefore, I'll give magic shrooms 1 skull, which is minimal damage, mainly because this drug is not as potent as other psychedelics. Lysergic acid diethylamide, commonly referred to as LSD or acid, is considered the best known and most researched psychedelic drug. LSD is active at exceptionally small doses, around 20 micrograms. But this drug is more potent than shrooms, and therefore the bad trips can be more intense and even traumatizing. So, 2 skulls for LSD, which is moderate damage. Empathogens are a class of psychoactive substances that enhance feelings of empathy and emotional openness, often by increasing levels of neurotransmitters like oxytocin in the brain. The drugs in this category cause sense of belonging, sexual arousal, mood swings, and dehydration. The following drugs fit in this category. MDMA is commonly known as ecstasy or Molly. Ecstasy often contains other substances like caffeine or amphetamines. MDMA is usually consumed in pill form. The side effects associated with MDMA use include dehydration, nausea, high blood pressure, aggression, and blurred vision. This drug is special because it is both a stimulant and an empathogen. It's also called the love drug, and it's the most used party drug. Strong 3 skulls for MDMA. At least it's not as addictive as cocaine. You may wonder, what is the difference between MDA and MDMA? MDA is similar to MDMA, but is more of an empathogenic psychedelic, whereas MDMA is an empathogenic stimulant. The risks of MDA are much like those of MDMA. However, due to its less frequent use, the long-term effects of MDA are not well understood. Strong 3 skulls for MDA, just like MDMA. Dissociatives are a class of psychoactive substances that cause a sense of detachment from reality and one's own body, leading to altered perception and cognitive processes. The drugs in this category cause numbness, euphoria, disconnection, and relaxation. The following drugs fit in this category. Ketamine is a dissociative anesthetic used medically for induction and maintenance of anesthesia. The use of ketamine can lead to long-term cognitive issues, and even psychosis in some cases. Most ketamine users experience a K-hole, which is the feeling of getting a high enough dose of ketamine to experience a state of dissociation and hallucinations. 3 skulls for ketamine. It's not as addictive as other drugs, and overdose is rare. Nitrous oxide, aka funny gas, is used as a dental anesthetic, and it's also used recreationally because it can induce a brief sense of euphoria and altered perception. The worst part about this inhalant is that it can cause vitamin B12 deficiency. If taken regularly, 1 skull for nitrous oxide, which is minimal damage, one of the least dangerous drugs, along with magic shrooms and caffeine.